Hello dear students, myself Bhavani Pintela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute. In previous lecture, we had covered with the anti-epileptic drugs part 1. In that session, we had discussed about what is an epilepsy and what is the major difference between the seizures and epilepsy, and after that we had discussed about the types of seizures, and after we had discussed about the classification of any drugs. In this session, we are going to discuss the rest of the part of an anti-epileptic drugs. So, without any further delay, we will just dive into the further session. So, in this session, we are going to concentrate on the mechanism of action. In the previous lecture, we had covered up to classification. We had seen the detailed portion of any types of seizures. We had explained each and every type of seizures like a generalized seizures, and next one is partial seizures. And after of that, we had discussed the classification and what are the drugs are going to used in the epilepsy. And after of classification, this is the continuation lecture for that previous lecture. Today, we will discuss about the mechanism of action. So, the mechanism of action is also called as a mode of action of any drug, by which you can understand in detail what the drug is going to do exactly in the body and how it will show its action to treat the epilepsy. Okay. So, here the anti-epileptic drugs, the main mechanism of action was it have to facilitate the GABA action first thing, or it have to decreases the sodium channel, or it have to inhibit the sodium channel, or it have to inhibit the calcium channel, or it have to inhibit the glutamate neurotransmitter. These are the drugs. What are the drugs we are using in epilepsy? The most of the drugs will be concentrate on these 4 types of mechanism of action. Some of the drugs will act on a GABA and it will promote the GABA action. Some of the drugs will block the sodium channel. Some of the drugs will block the calcium channel, and some of the drugs will decreases the release of glutamate neurotransmitter, because glutamate is a major neurotransmitter which is involved to treat the epilepsy. Here first I will say you how the epilepsy is going to happen, right. So, this is any presynaptic neuron, this is any postsynaptic neuron. Okay. So, this is the basic basic steps with the neurotransmitter. So, whenever the impulse has been generated, first the neurotransmitters will be stored in the synaptic vesicles. After synthesis of a neurotransmitter in the body, where it will go and store? It will store in the synaptic vesicles, storage granules. Once the impulse has been generated, what will be happen? Here you can see the sodium channels. Okay, the sodium channel will get open and the sodium will enter into the cell. Once the sodium will enter into the cell, it will triggers to open the calcium channel. So, here you can see the calcium channel. Here once the impulse has been generated, the sodium channel will get open, the sodium will enter into the cell, and this will leads to the opening of calcium channel. And now the calcium also will enter into the cell. Once the calcium enter into the cell, now this neurotransmitter inside the storage vesicles will, by the process, it will released into the cleft. Which neurotransmitter it is? It is a glutamate neurotransmitter. Okay, it is a glutamate neurotransmitter. Which type of neurotransmitter it is? It is an excitatory neurotransmitter. So, here what is the neurotransmitter is responsible for epilepsy? Once the sodium channel and potassium channel sodium channel and calcium channel has been opened, this will leads the neurotransmitter released into the synaptic cleft. And once this neurotransmitter released into the synaptic cleft, it will go and bind to the receptors. So, what are the receptors for the glutamate? The glutamate having mainly 2 types of receptor. One is inotropic receptor and second one is metabotropic receptor. The which receptor is responsible for epilepsy? Inotropic receptors are responsible for the epilepsy. So, what are the inotropic receptors here? AMPA receptor and second one is NMDA receptor. Right. So, one is an AMPA receptor and second one is an NMDA receptor. When this glutamate come and bind to the AMPA receptor, so opening of sodium channel you can see, right. And once this glutamate go and bind to this NMDA receptor, you can see the opening of calcium channel. You can see the opening of calcium channel. If you see the charge here, the sodium having the positive charge, calcium also having the positive charge. If the glutamate released into the synaptic cleft and coming and binding more and more to its receptor, more channel opening you can see, the more depolarization of an cell, more excitation of an cell. If the more glutamate has been released in your body, and this excitation will be passes to the next neuron, and the same excitation will pass it to its next neuron, and this excitation, if it happens continuously or very fastly, which can leads to the epilepsy. But why epilepsy is not seen in you and in us? Because we having the one more other neurotransmitter which is named as GABA. So, GABA is an inhibitory neurotransmitter. So, this is I am talking about what the how the epilepsy is happening in the epileptic patients, right, and why this epilepsy is not seen in you and me, because we having the inhibitory neurotransmitters like GABA. Whenever the glutamate release has been increased in your body, the body compensate this excited neurotransmitter. Now, the inhibitory neurotransmitter will get released. Once this inhibitory neurotransmitter has been released into the body, the inhibitory neurotransmitter will opens the chloride channel. The chloride channel having the negative charge, and this negative charge will compensate this positive charge, and which may not turn to the epilepsy. And what is happening in this epilepsy patient, if there is increase in glutamate release or if there is any decrease in GABA release, if anything is happening in their body which may leads to the epilepsy. If this glutamate excited neurotransmitter release is more, then also the particular patient can causes the epilepsy, or if the particular patient, if the GABA release is less or very low, then it can also leads to the epilepsy. Okay, these are the drugs which can use it here, right. So, if I am talking about these benzodiazepines, first look at here, the glutamic acid is a starting material to synthesize the GABA in the presence of glutamic decarboxylase enzyme. The glutamic acid in the presence of glutamate decarboxylase enzyme, what is going to form? It going to form the GABA, and this GABA and if you see it here, the GABA, it is an inhibitory neurotransmitter. This inhibitory neurotransmitter, which drugs are going to promote this inhibitory neurotransmitter? One is the benzodiazepines. Benzodiazepines will go and bind to the GABA A receptor, especially GABA A receptor, and it will increases the GABAergic action like opening the chlorides, okay. And barbiturates also will go and bind to the GABA A receptor. This is the first drug and this is the second drug. Apart from that, you can use the progabide. So, this is a third drug which having the GABA mimic action, it will increases the GABA action, okay. And apart from that, you can use the vigabatrin. Vigabatrin is a GABA transaminase inhibitor. So, GABA transaminase is an enzyme which will metabolize the GABA, which should not happen in the epilepsy patient. So, vigabatrin, what is the role of this vigabatrin? Vigabatrin will inhibit the GABA transaminase enzyme, right. And next one, tiagabine. So, tiagabine will inhibit the GABA reuptake. So, GABA reuptake, which drug is going to inhibit? Tiagabine, okay. And these are the drugs like benzodiazepines and barbiturates will open the chloride channel. So, all these drugs are used to treat the epilepsy. We will discuss one by one drug here. So, anti-epileptic drugs for pharmacological actions, first it will decreases, if I am talking about the CNS, it will causes the CNS depression. So, what is the action on CNS? It causes the CNS depression. And what is the action on CVS? It causes the CVS collapse when you had given intravenous administration rapidly. When you had administered rapidly intravenous route, it causes the CVS collapse. Or these are the drugs which causes the stabilization effect on the CVS. And what is the action on GIT? On GIT, it can causes the nausea and vomiting. So, this is the effect with the anti-epileptic drugs. And what is the action on endocrine effect? On endocrine effect, it is going to see the hyperglycemia. Hyperglycemia is an endocrine effect with the anti-epileptic drugs. And next one, teratogenic, yes, of course, the drug having the teratogenic action, when you had given the anti-epileptic drugs which may causes the fetal syndrome like a teratogenic action. face and gums. So, what is the action of anti-epileptic drugs on face and gums? It can causes the hyperplasia, hypertrophy. You can see the bleeding on the gums and the mouth. These are the basic things you can see on the face and gums. And next one, enzyme inducers. Yes, anti-epileptic drug like phenytoin. Phenytoin is a very potent enzyme inducers. If you have taken this drug with any other drug like vitamin D or folate or any contraceptive drugs, and this phenytoin drug will increases the metabolism of rest of the drugs like vitamin D, folate and contraceptives. So, with this phenytoin will increases the metabolism of these drugs. Once these drugs get metabolized from the body, what is going to happen? The action what it have to show, it won't show. So, here I will give a best example. So, this is an enzyme inducer. Which one is an enzyme inducer? Phenytoin is an enzyme inducer. So, with phenytoin you had taken the contraceptive drugs. Okay? You had taken these contraceptive drugs along with phenytoin. So, contraceptives, what is the purpose to take the contraceptives? To prevent the pregnancy. And if you are combining these contraceptives with phenytoin, phenytoin is a potent enzyme inducer. So, it will induces the enzymes in the liver and it will increases the metabolism of contraceptives. So, now the contraceptives will get metabolized from the body. Once the drug will get metabolized from the body, it will be eliminated. So, before showing its effect, before showing its action, the drug is eliminating from the body. So, which purpose you have taken this drug? To prevent the pregnancy. So, this is without showing its effect, it is eliminating from the body. So, this is the reason, or this is the thing, this is a caution you have to keep in your mind while you are taking the potent enzyme inducers, what the drugs you have to take and what the drugs you should not take. And if I am talking about the benzodiazepines, benzodiazepines are the drugs which will act on a GABA-A receptor and it will open the chloride channel. By opening of this chloride channel, which will causes the hyperpolarization and it is used in the epilepsy. Okay. And you having a lot of benzodiazepine drugs like diazepam, lorazepam, clonazepam. Okay. All these drugs having the different uses. If I am talking about these diazepam and lorazepam, which are used as an adjunctive therapy. So, these are the drugs adjunctive therapy you can use it, right. And what about this clonazepam? Clonazepam drug is used in a myoclonic and atonic seizures. You can use, I had explained what type of seizures these are. Myoclonic and atonic are the generalized seizures. These are the generalized seizures. So, these benzodiazepines, especially clonazepam is a drug which is used to treat the myoclonic seizures and atonic seizures. Okay. And next one is the lorazepam. Lorazepam is a drug which having a very shorter pharmacokinetic half-life. So, which can be eliminated very fastly from the body, right. And this is used in the diazepam and lorazepam is used in the myoclonic, partial and generalized tonic-clonic seizures. Because in this slide I had given a difference between which drug is used in which type of seizures. If I am talking about this clonazepam, you can use it in myoclonic and atonic seizures. What about the diazepam and lorazepam? The diazepam and lorazepam is a drug which can used in the myoclonic. Apart from myoclonic seizure, you can used in the generalized and partial generalized seizures like tonic-clonic seizures. And other benzodiazepines are also used to treat the various epilepsy. And next drug was benzodiazepine drug. This benzodiazepine drug next drug was barbiturate drug. This barbiturate drug also go and bind to the GABA-A receptor and will open the chloride channel. And how this drug will open the chloride channel? It will increases the lifetime of chloride channel. By increasing of lifetime of chloride channel, the more and more chloride ions will enter into the cell and will causes the hyperpolarization. Okay. So, this is the action with the barbiturate. By this hyperpolarization, the somewhat the cell excitation will get decreases and which can treat in the epilepsy. And very recently studies, they had very recent data, it has been given that phenobarbital is selectively used suppresses the abnormal neurons. If you are having any abnormal neurons, those abnormal neurons to suppress the particular abnormal neurons, you can use the barbiturate drugs, especially which type of barbiturate drugs? Phenobarbital. Okay. So, phenobarbital, recent study it has been declared that the phenobarbital can be used or selectively suppresses the abnormal neurons, right. And clinically it is used in the partial seizures and generalized tonic-clonic seizures. You can use in the partial seizures, it means simple seizure, complex seizures, secondary generalized seizures, and you can use it in the generalized tonic-clonic seizures. In generalized tonic-clonic seizures, it means grand mal epilepsy. A particular person who having grand mal epilepsy, in particular patient you can use this barbiturate drugs. And in previous lecture I had discussed about this barbiturate. Barbiturate is also an enzyme inducer. So, by taking of this drug with any other drug, this drug will induce the metabolism of any other drugs. And what is the adverse drug reaction of these barbiturates? It will causes the sedative action, it causes the osteoporosis, it causes the impairment, which impairment? Cognitive impairment. All these are the adverse drug reactions you can see with the barbiturates. And the next drug was immunostilbenes. Immunostilbenes is also alternative drugs which can be used to treat the epilepsy, and this is drug is proven which is used in the epilepsy as well. And this is the drug immunostilbenes are the drug first it is used as an which is used to treat the trigeminal neuroglia. Okay, which purpose you are using this drug? This carbazepine. Carbazepine is an immunostilbene drug, and this drug primarily it is used to treat the trigeminal neuralgia. Trigeminal neuralgia. In this condition this drug has been used, but later on it has been proved that this drug also can be used in epilepsy. Okay, it can be used in epilepsy. So, what is the main mechanism of action of these immunostilbenes? These immunostilbenes, whenever you had taken this drug, it will go and bind to the sodium channel. After binding of this sodium channel, it will block the sodium channel. There will be no opening of sodium channel, or there will be no entry of sodium channel into the cell. The main mechanism of these stilbenes, it will block the sodium channel. And what is the adverse drug reaction of these immunostilbenes? It can causes the headache, it can causes the vomiting, nausea and vomiting, visual disturbances. These are all the major adverse drug reactions with the immunostilbenes. And next one, clinical use. In which condition you can use this drug? And we can use this drug specially in partial seizure and generalized tonic-clonic seizure. So, poor person who are suffering from the partial seizure or any person who are suffering from the generalized tonic-clonic seizures, in such a condition you can use these immunostilbenes, and the immunostilbenes will work on the mode of action, it will inhibit the sodium channels, right. And next we will move to the next drug, succinamides. Succinamides are the drugs which are used to treat the epilepsy, and what is the drug you can use here? Ethoseximite. Ethoseximite is a drug which has been introduced on 1960. So, when it has been introduced, this drug has been introduced on the 1960. So, this is a drug which having the this ethoseximide, these succinamides, there are the three anti-seizures succinamide marketed in the USS. What are the three anti-seizures succinamides marketed in US? So, in USA there are the three succinamide anti-seizure drugs has been marketed. What are the three succinamide anti-seizure drugs? One is ethoseximide, second one is finsuccinamide, and third one is metsuccinamide. So, these are the three succinamide drugs which has been launched as an anti-seizure drug in USA. Okay. What is the main mechanism of action of these drugs? The succinamide drug, especially ethoseximite drug, will focus on the calcium channel. It will block the calcium channel. Now, this drug will competitively go and bind to this channel, and it will block the opening of this channel. If the blocking of this channel, there will be no entry of, or there will be no entry of calcium inside the cell, there will be no depolarization of any cell, there will be no excitation of any cell. In a such a way, the ethoseximide will show its mechanism of action. And ethoseximide, this is the continuation part here. It is clinically used in the primarily generalized absence seizure. So, if any particular person having absence seizure, what is an absence seizure? Here the particular person don't know what happened with him or her. Suddenly it will be happen for a few seconds to the minutes, right. In particular condition, in absence seizures, we can use the ethoseximide drug. and this ethoseximite drug has a limited use because of its narrow spectrum activity. So, which of the drugs having the narrow spectrum activity? Ethoseximite, barbiturate drugs, the warfarin drug. So, all these are the drugs which having phenytoin, all these drugs having the narrow spectrum activity, it having the low therapeutic index, even slightly increase in dose also causes the increase in toxicity. So, what is the major adverse drug reactions of these drugs? The major adverse drug reaction was euphoria, intolerance, tiredness, somewhat you can see the changes in mood, you can see the headache, and you can see the hypersensitive reactions. What are the hypersensitive reactions? Allergic reactions, urticaria, angioedema, okay, allergy reactions, rashes, all these are the hypersensitivity reactions. By taking of this ethoseximite drug, you can see the adverse drug reactions like vomiting, headache, mood changes, hypersensitivity reaction, drowsiness, and intolerance effects. All these are the things we can observe with this ethoseximide. And next we will move to the aliphatic carboxylic acid. What is an aliphatic carboxylic acid? Aliphatic carboxylic acid example was valproic acid. What is a drug you can use in epilepsy? Valproic acid. Valproic acid was increasing its acceptance to treat the epilepsy. Why it is increasing its epilepsy? Because it is nowadays it is using as a first line drug to treat the epilepsy. Which drug? It is a valproic acid. Valproic acid is an aliphatic carboxylic acid which is increasing its acceptance. It is treated as a first line drug to treat the epilepsy, and it having the less sedative action than that of the anticonvulsants. If you are comparing with the rest of the anticonvulsant drugs, this valproic acid having the less sedative in action, right. And what is the main mechanism of action of these drugs? This will facilitate the GABA action. This is the important thing you have to remember. And what the valproic acid is concentrating here? It will concentrating the facilitate the GABA action. Apart from that, it will inhibit the sodium and calcium channel as well. So, valproic acid is a drug. Which drug it is? Aliphatic carboxylic acid. This is a drug which will block the sodium channel, which will block the calcium channel, and which will increases the activity of GABA neuron. It will increases the GABA action. So, this is the mode of action of any valproic acid, and clinically it is very effective to treat the absence seizure and the generalized tonic-clonic seizures. So, the patient who having the tonic-clonic seizures, the patient who having the absence seizures, in such a patient you can give the drug valproic acid. It can block the both sodium and calcium channel to decrease the depolarization. And if you see here, the some patients, and this not only the generalized tonic-clonic seizures and absence seizures, and it has been proved that it can be used in the atonic seizures as well. And there is some evidence that you can take it. This is the drug which is effective in the partial seizure as well. So, this is the best drug which is used in the multiple purpose generalized seizures like tonic-clonic seizures, atonic seizures, absence seizures, partial seizures. In all seizures, you can use this valproic acid. What is the major adverse drug reaction of this drug? After taking of this drug, the person can increase his or her weight, which can causes the hepatotoxicity. So, this will causes the liver damage. The valproic acid will causes the liver damage. Apart from the liver damage or apart from the increase in weight, it can causes the GIT upset. So, there is somewhat GIT disturbances in the body. This is the adverse drug reaction with the carboxylic acid. And the next one is GABA analogues. So, GABA analogues are the drugs which are going to increase the GABAergic action. How it is going to increase the GABAergic action? So, this by promoting the activity of GABA by opening the chloride channels, right. So, what is the GABA analogues here? Gabapentin. So, gabapentin is an amino acid, it is an analog of GABA. And what is the mechanism of action of this drug? What is the mechanism of action of gabapentin and how it will work to treat the epilepsy? It will facilitate the GABA mediated chloride channel opening. So, how this drug? It is a GABA analog. So, this drug will go and bind to the GABA channel, GABA receptor, and when it bind to the GABA receptor, there will be the opening of chloride channel. Once the chloride channel will be open, more and more chloride will enter into this cell, and which will causes the hyperpolarization, and the excitation of the cell will be get decreased, and which can use it in the seizures. And next clinically, and which purpose you can use this drug. Clinically, it has been used in partial seizures. So, it is very much effective in treating the partial seizures. So, who having the partial seizures, you can take the gabapentin drug or pregabalin. This is the another drug. Which drug it is? Pregabalin. Pregabalin is used and is used as another GABA analog which is recently approved in the USA. So, this is the another drug beta. Which is the another drug? Pregabalin. Pregabalin is another drug which is used as a GABA analog and which is very much used in USA, and the drug acceptance is also very much increased here. And it is used in anti-seizure activity and in analog analgesic properties, right. And what is the major adverse drug reactions of this gabapentin, or what is the adverse drug reactions of the GABA analogues? It can causes the dizziness, unsteadiness, it can causes the mild sedation, it can causes the tightness of a body. So, these are all the adverse drug reactions you can observe here. So, this is about the GABA analogues. GABA analogues are the drugs which are going to provoke the action of GABA. This is the amino acid which are the analogues to the GABA. When these GABA analogues like gabapentin, when go and bind to the GABA receptor, which type of receptor? GABA A receptor. When it go and bind to this GABA A receptor, the channel will going to open, and this channel, which channel is going to open? Chloride channel is going to open, which will causes the decrease in excitation of any cell. And neuroepileptic drugs are also used to treat here, like vigabatrin is one of the newer drug to treat, which is an analog to an GABA, and which mechanism of action it is used here? It can inhibit the metabolizing enzyme of GABA transferase. So, GABA transferase is an enzyme which is going to metabolize the GABA. So, this vigabatrin will inhibit the GABA transferase enzyme, and it will increases the action of GABAergic neuron. And what is the major adverse drug reactions here? It causes the depression. Depression is one of the major adverse drug reaction, psychotic disturbances, and some patients who having all these side effects was very much little, and relatively this is the drug which having the this is the drug which having free from side effects. These are the anti-epileptic drugs. Here I had given the category at which type of seizures and which primary drug of choice you can use here, and what is the secondary drug of choice and what is the third drug of choice you can treat the epilepsy. Thank you.